What we've told the patients is that as soon as we can operate on them, we will. We've got cataract patients who are waiting for their surgery, and some of them are like, at all other times, they're modestly inconvenienced by their cataract, and they'll continue to be modestly inconvenienced. Some of them are greatly inconvenienced, and it's kind of age independent. We've got folks who are in early retirement, and only one member of a couple is able to drive, and that's the one who needs a cataract surgery. And yes, they can sort of kind of drive, and yes, they can sort of kind of pass their driver's test, but they're afraid to drive at night. Our glaucoma patients are very, very, very on edge right now. Do I have to be seen? When can I be seen? And so there's a lot of communication between the office and those patients. The surgical patients are the ones that are hard. They're hard because you get all ginned up, you get all geared up to have surgery, and even though it's an everyday thing for me, it's an everyday thing for our staff, and it's the same for us as logging into your computer if you're a coder. But for a patient, it's hopefully a twice in a lifetime thing, and it's almost like you're getting ready for opening night, and you're standing in back of the curtain. The audience is out there, and the curtain doesn't rise. So there's a psychological effect to the patients, and we're doing our best to help them along. I'm not doing life-saving surgery. I know where ophthalmology fits in the greater scheme of things, but countless studies have been done over the ages that show that patients are intensely concerned about their vision. Every study ever done, every survey ever done says that patients value their vision above all their other senses. And so it's a highly emotional thing for them. So whereas we're not really an essential practice, we're not an essential service when you compare us with the people who are just fighting so valiantly in the front line, in the ICUs and the pulmonary ICUs and in the ERs. We're not there. I have no illusions about that. The last thing that I think I want to say is just two things. What I do for my own sanity, and I have for years and years, is I write. And I write from wherever my better self lives inside me. And I think that there are two things that we as people should be doing. The first thing is take care of yourself. Take care of yourself. Do the things that you have to do to get up, to go about your day, to stay healthy. Do the things that are going to keep you upright and going forward. And then the second thing is equally easy. Be kind. Be kind. Think about everybody around you. Everybody's got their own thing going on. Nobody's is more or less important than anybody else or yours. Be kind. Make your first instinct kindness.